Hi, and welcome to Contour by Colette. I'm going to ask you a question. Does it make me a bad nurse practitioner if I prescribe a GLP-1 GIP to a person that is of healthy weight? Let's get into it. You'd almost have to be living under a rock if you have not heard of Tirzepatide, otherwise known as Mounjaro, which is approved for type 2 diabetes, and Zepbound, which is approved for weight loss, and most recently, sleep apnea. This is a very interesting question that I pose, because if you do not have either one of these diseases, since these drugs can be written off-label, because many of our drugs are written off-label, does that make me criminal to prescribe it to somebody that has a normal BMI? What if I told you that it might offer serious longevity benefits, even if you're already of healthy weight? I will disclose that I have been on various types of GLP-1, from Victoza, Byetta, Ozempic, Tirzepatide, since 2014. And before that, I took something called Stimulin, which is otherwise known as amylin, a peptide produced by the beta cell that is an alpha agonist to glucagon. You can see my video called Cagrilintide, which is the long-acting ester, soon to be approved with Cagrasema by Novo Nordisk as their new weight loss drug in 2026. There are so many indications that are waiting for GLP-1, and those include type 1 diabetes, that's coming in the next 1 to 2 years. Pre-diabetes. What if you have PCOS? What if you struggle with alcohol and addiction? What if you have a bad relationship with food? Or you have a binge eating disorder? You have cardiovascular disease. What if you have renal disease? High C-reactive protein, that's never good. And end sedimentation rate. So your ESR and CRP, those increase, they're high inflammatory markers that lead to disease. Well, what exactly is this magical Tirzepatide? It's a glucose-like peptide 1. It's a natural peptide in your gut, just like GIP, which is a glucose-dependent insulinotropic polypeptide. They're both incretins. Actually, Stimulin is also an incretin, that are secreted in response to food, and they play an essential role in regulating metabolism. When used pharmacologically, like Tirzepatide, they have a very broad spectrum of benefits, well beyond weight loss and diabetes. If you have seen my video that I did with Dave Palumbo, some of you have watched that and reached out to me. It's about insulin. And I discussed the use of insulin in longevity because glucose is the root of all evil. And we spend billions of dollars band-aiding it, not looking at the root cause of glycosylated end products. Fact. On average, fasting glucose increases by 1 to 2 milligrams every decade after 30. This can vary depending on your lifestyle, your activity level, your diet and weight. Well, how about stress? How about sleep? How about the fact we live in America? We're exposed to so many chemicals. So, you're in your 20s and 30s. Your fasting sugar's below 90, hopefully 84. Now you hit 30s and 40s. Now your fasting sugar is 85 to 95. Then you hit your 50s and 60s. Now you're 95 to 100. Then you hit your 60s and 70s. You're 90 to 100. And then you hit your 70s to 80s. You're over 100. This is impaired glucose tolerance. Guys, 1 in 5 people have diabetes. And there's 17 million people that have pre-diabetes. We're all one cookie away from having glucose intolerance. People always ask me, why are you on a GLP-1? I mean, look at you. Gets so much criticism. It's just such a, it creates so much anxiety in people, like you're doing something wrong. But guess what? Even normal weight people can benefit from GLP-1s. Why? Because it improves insulin sensitivity. Chronic high insulin levels are linked to aging and inflammation. It enhances insulin secretion in a glucose-dependent state. It suppresses glucagon, your inhibitory hormone to insulin. And it slows gastric emptying, so you're not so hungry. So food isn't the only thing you're thinking about all day. I just can't wait till my next meal. I can't even focus. I can't even work. You don't worry about that anymore. You become more productive. You can get more done. It lowers inflammatory markers. CRP, interleukin 6. Interleukin 6 is a protein that acts in a pro-inflammatory state, and it can signal the immune system, metabolism, and nervous system. They're both linked to age-related diseases. It reduces visceral fat. Even skinny people can have visceral fat.
Images depict two patients, one with morbid obesity and a tremendous amount of visceral fat, the bright yellow part in the middle of their abdomen, whereas this patient is normal weight, normal BMI, who also has a tremendous amount of visceral fat. You can be thin and have a normal BMI and have a very high level of visceral fat.
This is that hidden abdominal fat in your visceral organ. It enhances cardiovascular markers. It improves your blood pressure. The new goals are less than 120/80. Have you tested your blood pressures lately? It lowers your triglycerides. It improves your HDLs. It lowers your LDLs, your overall lipid profile. It lowers the systolic blood pressure. It improves the endothelial function of all your vessels, reducing your risk of plaques, strokes, hypertension. It actually reduces the risk of cardiovascular events. And this has been tried and true in clinical trials known as the LEADER trial and the SUSTAIN trial. It stabilizes blood glucose, so there's less swings. There's less highs and lows. You feel more stable. Your mood is more stable. All these variability, if you wear a continuous glucose monitor, you see that. People that don't have diabetes see their blood sugars going to 150, 160. It's all linked to oxidative stress. It's all bad, all bad. It's neuroprotective. Yep, it's neuroprotective. It may reduce your risk of Alzheimer's disease and Parkinson's disease. There's clinical trials going on right now. It improves cognition because it crosses the blood-brain barrier. Well, how about liver disease? How about non-alcoholic fatty liver disease? Yep, it's one of the #1 medications to help with fatty liver. The pancreas, I love this one. GLP-1, it strengthens the beta cell, where GIP increases the number. It's being used by pediatric endocrinology with Tirzepatide, which is a monoclonal antibody that's helped type 1s sustain the amount of time that they have in a honeymoon state. It's incredible. So you have type 1 diabetes, you take Tirzepatide with Mounjaro, incredible. Reduces albuminuria, kidney disease, wow, great. Slows the progression of diabetic kidney disease. Anti-inflammatory and longevity. If it lowers all those inflammatory markers, it may reduce senescent cells, it activates AMPK, and may support autophagy. Wow. It's not over then, okay? Bone, yep. We're finding new data that it stimulates osteoblast activity, reduces bone resorption. What about all of my frailty and osteoporosis and the poor women that don't know or are naive or never been taught that they should be on hormone replacement? What about central nervous system, the brain? This is the best. That reward system. Whether it be satiety, whether it be that reward system you get from gambling or alcohol or drugs, it modulates that balance and that reward mechanism. Sleep apnea. Wow. Improving breathing during the night. As you reduce your weight, the pressure goes off the airway, allows you to breathe easier. And this is just the beginning. We're just untapping all the different cellular responses to GLP-1. Now let's be clear. It's not without side effects. I'm not going to sit here and tell you, nope, there's absolutely no side effects, because there are. But I often ask, and I'm going to say, is it fair to say that, is it, these side effects, nausea, vomiting, diarrhea, constipation, the GI side effects, is it the drug? You could say for sure because it slows down gastric emptying. Or is it more the person using the drug? If you're aware of these side effects and you eat fried foods, a high-fat diet, high in processed foods, low in fiber, no vegetables, low in protein, I mean, it isn't going to go well for you. So you have to go into this with some dietary knowledge. Things are going to have to change. And I often use the analogy, when you go into bariatric surgery, 2 weeks before the surgery, you're on a liquid diet. So oftentimes you have to not expose your gut to these usual foods that you're eating and start slow before you can actually be able to eat a fatty food or the things that are not good for you. In the near future, we may see a shift in where this tool, like Tirzepatide, are used for preventative measures like a statin and metformin. The WHO in 2023, you can look this up, made a statement that these peptides should be part of the essential medication list, like simvastatin, rosuvastatin, pravastatin. And it drove the first generic being liraglutide, which is currently in shortage based on the cease and desist that is going to be instated by the government May 22nd, 2025, with all the compound pharmacies no longer being able to dispense Tirzepatide and semaglutide. Some longevity doctors are already experimenting with microdoses in a non-obese population. You don't need to lose weight, but you do need to consider the benefits of a GLP-1 on your overall system health. Tirzepatide isn't just a weight loss drug. It isn't just about diabetes, although diabetes is a full spectrum, where with all the improvements in glycemic control is aiding into the longevity. It's part of a broader metabolic revolution. It's a revolution, one that can help us live longer, healthier lives, even if we're already fit. It's not about just getting skinny. It has nothing to do with that, at least not for me, and not for many of my patients. It's about becoming more resilient. I want to say one last thing. People love fear-mongering, and social media does better if I sit here and tell you all the bad, horrible things that are going to happen versus all the beautiful things that are going to happen. It's like watching a train wreck. People love to watch it. But I want you to see the beauty in a GLP-1. I want you to open your mind, and I want you to get educated. If you ever need to consult with me, it's contourbycolette.com. I have licenses in California, Texas, Florida, Michigan, New Jersey, and New York. I've had the most experience with these drugs. I've been using them since 2005. I've personally been using them for over 11 years. Actually, really much longer because I have a lot of experience with Simlin. I think we need to look beyond what you see at surface level and open your eyes to a healthier, happier life as we enter into the later years. Thank you so much, and speak to you soon. Bye, guys.